quite nicely, almost like it was by design. I'm happy and honored to be moderating this panel today on the idealized scientific futures, and in particular, how we can start laying the groundwork for that idealized scientific future today. I am pleased to be joined by four very distinguished panelists here. Katie Baca-Motes, Andy Coravos, Peter Goodhand, and Gustavo Stolovitzky. And instead of me giving introductions and providing incomplete information about how awesome all of these people are, what we're going to do instead is allow each one of the panelists to answer a question. And that question is, what is some aspect of your idealized scientific future? And really we're talking about sort of the scientific process, how knowledge becomes generated and translated, and how is some of your work currently laying the groundwork for that idealized scientific future. So I'm going to hand it over to Katie to get us started.
Yeah, sure. So I'm excited that we get to talk about the ideal world because most of my day is spent talking about the real world, and this is so much easier. My ideal world, one aspect of it is really around a theme that we've heard time and time again today around inclusion and diversity, and the need for inclusion and diversity in biomedical research. So ideally, anyone, anywhere, could raise their hand and participate in and benefit from biomedical research. And that's really some of the work that we're doing here at Scripps Research. We lead the Participant Center for the All of Us Research Program. And for those of you who are not familiar with All of Us, it's a large study run out of the National Institutes of Health with several collaborators across the country. At Scripps, we have 15, it's led by Scripps, but we work with 15 really key partners, including Sage Bionetworks. And the All of Us Research Program is really looking to break this mold, and really a key component of the program is diversity and inclusion. So we've gone out and we've kind of thinking about ways that we can change research and really thinking about partnering with our participants from the very beginning, collecting data from 1 million or more people across a diverse set of participants across the country and bringing in a broad, diverse set of data. We're doing great so far. Of the 170,000 or so that have completed all the initial parts of the protocol, we're at 81% who fall into a category of traditionally underrepresented in biomedical research. 51% are of race and ethnicity categories that have been underrepresented. At Scripps, we need to break that mold even more. Most of the research or most of the process that's done in the All of Us Research Program and in other clinical trials is really still built around that traditional clinical research model where you go into your health provider organization, they're face-to-face, meeting with you, going through the consent process and enrolling you in the program. Well, we're tasked with everybody else. So we have health provider organizations, federally qualified health centers in the VA who are doing that. Scripps' role is, with all of our 15 partners, is to figure out how do we do that. Anybody, anywhere who wants to raise their hand, become a full participant in every single zip code across the country. So it really takes us thinking about, how do we do these things differently? How do we bring in new partners that have never worked in medical research before? How do we take advantage of all of the technology advances, the work that Sage has done on e-consent, and how do we take that even further to collect biosamples and things across the country? So that's a little bit about what we're doing.
Great. Okay, Peter? In one way, I can save time by just saying my idealized scientific future is very much the one that Eric just presented so eloquently, so passionately. But particularly picking up that last point, the question from the audience, or the comment from the audience, this idea of an ecosystem. So coming from a career in industry and large charities, now the Global Alliance, I've spent the last 30 years moving health research into healthcare, whether it's products or practice or policy. So part of my idealized scientific future enables this rapid transition into healthcare, but then also learning from healthcare. And not just learning from the very exceptional academic health science centers around the world, but from community settings. And what we're seeing in the work of the Global Alliance, we knew as sequencing came down that genomes would increasingly come from health budgets, not from health budgets paid by healthcare of any kind of system versus research grants. But if we follow the pattern that's happened with just about every other advanced technology that's come from research into healthcare, we'd lose the opportunity to learn from it. We wouldn't get secondary use of that once it became a health product as opposed to a research output. And so for the idea of an ecosystem, and not just a city ecosystem or a vets ecosystem or a Kaiser ecosystem, or Finland or Estonia, to the question about a country with great national health care, it's relatively easy. But creating interoperability, applying those FAIR principles across diverse systems, funded differently in different countries, different legislation, is a huge, huge challenge. That is what Global Alliance is working on. And I'll just perhaps highlight a few of the barriers that we can address and some of the enablers that are more difficult. So relatively speaking, bringing down the technical barriers to data sharing, including health data, you can use federation, you can create interoperability, you can build APIs. So creating the technical ecosystem is relatively easy. There are more challenges when it comes to policy and ethics and regulation and privacy, but you can design well from the beginning and you can create interoperability, harmonization, reciprocity across systems. What's perhaps more difficult is to change incentives and cultural norms and behaviors and business practices. So I think although we've come at this from a technical standards perspective to create the kind of system that Eric described, over 100,000 healthcare institutions or 1,000 different systems, when it comes to something like rare disease, particularly ultra-rare diagnosed disease, we won't solve that problem in Seattle or in New York or even in the US. So depending on the disease, depending on the complexity and the rarity, applies the same to rare cancers. We've got to do global data sharing. The minute you put in health data, it becomes massively more complex. So my idealized scientific future will be bring together a big community, create the incentives, create the cultural norm, bring the thinking that's in this room around open science and embed it and enculturate it in a system of healthcare that is usually closed healthcare. We've got to bring open science into closed healthcare.
I'm Andy. I guess I'll start my idealized future with something that happened last week. So I went to Duke, and Duke started to bring together a number of different scientists looking at the concept of trust. And one of the pieces of data that they gave is they ranked all the different types of jobs in the United States, and they said how trustworthy did the American public perceive those jobs to be. So how many people here would say that you are not largely in the field of science? Okay, most people here are like largely in the scientific field. So the most trustworthy job were military members in our country, and the second, and right up there were scientists. And then really far down at the bottom were like our Congress people. And one of the things that they looked at for this is like, what are these public perceptions and like what does trust actually mean for everyone? And they brought in a marketer, which I think a lot of scientists don't often think to do. And I'll just give you a pause if you have a pen. If you had to put one word that the American public thinks about scientists, what word would it be? Underfunded. So the word that popped up, which was surprising to me, was hope. So the field that we're in represents hope for many people who do not have the opportunity to spend their days doing what we do. And we are able often, I think in many ways, to create the magic that people wish they have in their day-to-day life into something real. And so what I hope that we continue to do is like cultivate that hope for the society that we live in. And I think a lot of that is based in maintaining trust. And I think we're at a really unique period in our scientific journeys as to what trust means. And in the past, a lot of trust was, the gatekeepers were who had information, like who was able to get access to books, who was able to find things. Now with the internet, there's so much information, and then there's so much misinformation and disinformation that it is really hard. So it's no longer as much about like getting access to information, but being able to filter it. And filter it effectively for different types of people. So what I work on and what we're doing with Elektra is we are looking predominantly at remote monitoring and sensors and wearables and how we can better take care of people at home and better monitor people at home. I served at the FDA in the digital health unit as an entrepreneur in residence, working on software as a medical device and machine learning and AI and a lot of the different tools that are coming out. A longer thing, I try not to use the term AI, that is what it's called there, but like it's just algorithms, right? So all these things are just models, and we need to figure out how trustworthy they are. And yeah, so I think a lot of the things that I'll probably talk to you today is around how do we make sure we're filtering that signal from noise, and how do we make sure that these tools are best serving the population that holds us in a very high esteem.
Thank you. My name is Gustavo Stolovitzky. I am with IBM Research, and I'm part of the people who make dream challenges. And so, what is the future that I imagine? So I thought that to make this a little bit more vivid, I would use a little analogy. So, but I don't know how many people here like crossword puzzles. I mean, I like it. Anybody? Okay, great. So imagine. So it might take you every day, quite a long time to finalize the crossword, to finish it. There will be gaps there and so on. But imagine that we have all the people here that like to do crossword puzzles, participate through a website, and each of us will know a little bit about history, some others about geography, art, literature, science. I'm sure that we could do that much faster, right, than anybody independently, right? So the idea of using the wisdom of the crowds to suddenly solve a problem that is solvable in that case, that we know the solution, so we can see whether we made it correct. But leveraging everybody's skill and talent and knowledge. So now, so that my future is not crossword puzzle solving, right? So, but is take a serious global health problem, such as, for example, the emerging resistance to artemisinin for malaria in some pockets of the world, in Southeast Asia. Now, let's imagine if we all could contribute a little bit from our knowledge, from the epidemiology, from the transcriptional understanding of Plasmodium, from the understanding of the pharmacology of it. Imagine that each of us could go in the morning to see how the status of the progress in that field is, and we contribute with whatever. So someone says, look, I collected this data set, but I don't know how to analyze it in the context of all the other data, and we go there and contribute with whatever we know, as when we are trying to solve a crossword puzzle collectively, everybody bringing what we know best. What am I doing in order to make this happen today, which is the second part of Brian's question, is when we do these dream challenges, which is basically we open data sets so that people can analyze them, produce models, and then benchmark those models to solve a particular question. We start with a competitive phase. People are excited to go and compete and show how well they solve these problems and maybe win and then be crowned with giving a talk in a dream conference. But at the end of that, since a few years ago, we create what we call a collaborative phase, in which people who have competed now, got that nerve out of their system, and now they are able to say where they failed and compare with others where the others are better than the first, and somehow fill this crossword puzzle with pieces of information that one has and the other doesn't, right? But it's not enough, right? There has to be a bridge that goes from there to the imaginary world in which we can solve global health problem together, which is economic funding models are unclear there. Psychological, what will motivate people to go and participate in that, and and incentives, right? How do we incentivize that in terms of giving credit for people who participate in team science and so on. So, and I think this conference will help us move a little bit in that direction.
Great. So before we go on, I have to ask you, do you do crosswords in pen or pencil?
Yes.
Which one? Both?
New York Times, yeah. Both, yeah.
Oh, okay. Twitter poll for that one. So, there are some themes that have started to emerge about, what an idealized scientific future might look like, and it sounds like a lot of it has to do with translation, and it has to do with how an individual can benefit from the outputs of the scientific research ecosystem, and Peter, to your point, the tension between systems and individuals, right? So I'd ask the panelists, anybody can jump in. There are some glaring gaps between how a system, whether it's a healthcare system, whether it's a research ecosystem, operates, and how an individual, whether that individual is a scientist or whether that individual is a patient, interacts with the system. And I think we're seeing the importance of both of those things. We're seeing the importance of systems, and systems being, collections of people, collections of ideas. But then, how do the individuals and their incentives sort of fit into that? So I'll open it up to the panel to chomp on that.
I have a case example.
Perfect.
So there was a Harvard Business School case written about the San Bernardino iPhone incident, where this was a mass shooter had an iPhone, and that people were interested in having a backdoor to that iPhone of whether or not you could figure out more information about someone who committed a pretty horrendous tragedy in the United States. And the title of the case was called something, Apple should create an encryption backdoor, and it was security versus privacy, where the positioning was at a system level. If we want to have security in the system, we would want somebody to be able to create a backdoor and be able to look at what is on that phone, and versus the individual on privacy. And this framing really bugged me because you actually can have security on both sides, and I think this is one of the main issues. So the core tension in that one is actually surveillance versus privacy, where you might actually have a more secure system if you're able to maintain the rights of an individual, or you might have a more secure system if you're able to maintain the rights of the system. And I think the words that we pick when we create these sorts of tensions around the individual and the system, because everyone wants security, right? But surveillance feels a little bit different. And so I think in the world that we have today, where there's Twitter and everyone wants to have the short, this one answer is right, there's a lot of things that are inherent tensions, particularly at that system and privacy level, that aren't going to be clear, that take conversations like this to unpackage what they actually are underneath.
And just to jump in real quick, it's interesting that you went with surveillance versus privacy as well, because surveillance actually in some academic spaces, scientific spaces, is a positive word. And Peter, maybe you can speak a little bit to how surveillance or large, looking at broad swaths of information can be beneficial, but again, with the tension of privacy.
Yeah, so it's interesting. So there are some really good opportunities in surveillance and in public health. But in fact, most of the work we've seen today has been outside public health, and it's been in precision medicine, precision health, but increasingly in cohorts. And so we're now seeing some initiatives both with common disease cohorts that people like Mark Daly, Eric Lander are bringing together, or population cohorts that people like Jeff Ginsburg and others are forming to look across cohorts. And all of a sudden we're now seeing potentially 30 million people. And what can you learn from 30 million people with some level of genotyping? But the data is in different languages. The genotypic data may be in the same language, but all the health data is likely to be in local languages, different frames, different tags. And so that to learn from that massive surveillance or that massive cohort is actually, it's the human side of the data that's more complex than the scientific side of the data, which tends to be more structured and consistent. But I just also want to pick up on your comment about translation. So I think we've tended to think of research coming through translation into healthcare. What I'm starting to see all around the world is this idea of evidence-generating medicine that monitors and tracks how evidence-based medicine. So whether that's a learning health system, it's real-world data, real-world evidence, but the idea of don't just move it in a linear fashion from research into practice, but once it's in practice, continue to learn. So it's a different kind of surveillance, but it's that idea that you don't stop learning once you start delivering healthcare. And I think that's, for me, that's the best example I've got of surveillance right now.
And Katie, maybe you can speak a little bit to the All of Us research program, in particular, their focus on the individual. Even though it is billed as this 1 million person cohort, I think they've been very intentional about having it be about the participant.
Yeah, we built that into the program from the beginning, so we do our best to treat participants as partners. I think we, as a program, still struggle with some of the tension that we've talked about earlier. Really, who owns the data? Who should be looking at it? So you've got, as scientists, we kind of assume, I think Eric said before, you assume everybody wants to know everything. I mean, Eric Topol would say that too, and we're like, no, not everybody wants to know everything. And then you have the paternalistic view of, okay, when we return this information, are people going to understand it? Do they have the right to their own data if they're not going to be able to understand it? What are the downstream consequences of that? So many working groups looking at this tension of how much information do we need to give, and in what way to be responsible, to be ethical, and to make sure it's useful, valuable information for the individual and for the participant. And I think that's where, groups like this are really great, and that's what we've tried to do in the All of Us research program too. So it's not just, the scientists on the genomics side and on technology, but we're bringing in, that's why I get to work on this. I'm a behavioral scientist and look at behavioral economics and look at incentives and motivations. We have Ben Greenberg here in the audience who works as our chief product officer, who came from WebMD and looks at, creating products that millions of people will use in a way that's easy and useful. So bringing in all of that together, I think we'll hit that sweet spot of what sort of data that we want to get back to participants in a way that's useful and meaningful for them. But it's going to take some time. And I think this program, we're being really innovative in one particular area, and it's led by Sage again, and giving us the opportunity within the IRB to test these things, because we don't know exactly how to present this information back to people. So even the idea of running simple like A/B tests to see, do people comprehend it better this way? Do they find this valuable? And test that in a robust way is something new and novel in this space, and that's what we're trying to do so we can find that sweet spot quicker.
Great. So, riffing off that a little bit, we're seeing a number of different types of players emerge in this space, in particular as it relates to the semaphores of the world, really trying to take research and knowledge and make it actionable and useful for individuals. I'm curious if the panelists have thoughts on the types of roles and or organizations that are going to be increasingly important as we shift to having to give really complex results and information to the public at large, to individuals. Any thoughts?
Very good Very good question.
Yes.
I mean, I'd differentiate between the interoperable standard setting work that Global Alliance does, but we need everybody. It has to include academics, it has to include healthcare, it has to include industry, and funders and regulators. So if we cannot come together on the interoperability as an ecosystem, then I think we'll fail, but the implementations will be different, and how it's done in a public health system like Estonia will be very different from how things are brought forward in the US. But there are about 40 what we call national initiatives right now, of which all of us will be one, where they are trying to make this much more population or participant-centric approach to it, whether it's Genomics England, Australia, Sweden, Switzerland, and all of us here. So a much stronger focus on the individual, and therefore, I think as we come out of those examples, those 40 or 50 examples around the world, the question will be how it pivots into routine healthcare, community healthcare, and it disseminates across all the people who are not in Mount Sinai. So I think that's the big challenge right now. We've got some great examples, Geisinger in the US, of progressive looks at how to bring in new knowledge. And then my only other point will be, when it's knowledge, it can be shared openly, publicly, and globally. So when we started the BRCA challenge, it was because the world's BRCA knowledge was locked up in proprietary databases. And what was in the public domain was fragmented and incorrect. What we have in the BRCA exchange today is something that anybody in the room from an app on their smartphone could look up the best knowledge in the world on BRCA 1 and 2. And it's been expert curated, the augmentation piece, 25,000 variants. So we've created globally accessible, open, public knowledge. But if we were looking at case level data, that would be protected and controlled. So when it's knowledge, share it publicly.
Another group to possibly think about, so I think in a lot of health situations in the past, we got like stocks of data. You would get little snapshots, like I had a blood draw, I had my like DNA sequence. What's happening now is we have flows of data where you're like collecting someone's step counts or you're collecting their heart rate. And when you have flows, the only way you can do that is effectively through connected products. And now that we have more things connected to the internet, that creates like a whole different world of stakeholders that we need to consider. And mostly just because I'm curious, how many people here know what DEF CON is? Raise your hand. Yes, we have a bunch of rogue people. So DEF CON is probably one of the biggest security conferences. You might have heard about them in the news last year. There's villages that sit underneath. There's a voting village that bought a bunch of voting machines, and then they hacked them, found the voting records, and then sent the results back to Congress. It's like Ed Snowden-y stuff. So there is a group there that looks at a lot of medical devices and medical products in one of the villages called the Biohacking Village. And they'll do different types of tests to see like how these sorts of their protocols are working. So I'm a software engineer by training, and so I do get mixed sometimes. So like protocols in software is very different from clinical trial protocols, so you'll have to stop me if I'm saying different things. But effectively, they found a number of different security issues in pacemakers where they were able to drain the battery, they were able to reverse engineer a shock, and then when they tried to be transparent and talk about the results that they have, they did what most people in tech would do, is you would do something called coordinated disclosure, you talk about the bug, and then maybe you get a bug bounty and the company ships an update and you're fine. So they went to device companies and they said, hey, we found this bug, and the device company said, oh, thank you, we're gonna sue you now. And they're like, what? Why would you do that? They're like, well, you tampered with our product, we're regulated, and so now we have to sue you. And so thankfully, the FDA stepped in and said, you can't just sue security researchers and white hat hackers, you have to ship an update. And so the FDA started attending DEF CON, which is pretty wild, because if anyone knows like that you go, like sometimes government agencies go, like NSA and CIA go, but there's a game called like Spot the Fed, and like it's a little weird. So I think I think like particularly in science, like we as like scientists like hold education and degrees to have the currency. And so like when you're met with a group that really does not care so much about those things, you start to have like a lot of different disconnects around it. So you can see like why that type of dynamic would play out. So I think as we start having more connected products and as we have different types of vulnerabilities than we've never thought before, it's not just like I have a DNA vulnerability, like I have now a connected product vulnerability. We're going to need to work with different groups to make sure we patch those.
You know, I was thinking that we are hearing lots of people who do not get their kids vaccinated, right? They don't believe in that, or they have information that is kind of unscientific. Some people that believe that the earth is flat, right, and there is a movement now. So I am having a little bit of an issue with reconciling the depth of this information that we want to transfer to the individuals in order to manage their own health, and the degree of ignorance that there is also prevalent in the general population. And we are talking here, you know, we are an elite, if you will, that in the sense that we understand these kinds of issues, but most people, you know, are completely refractory to these kinds of things. So I believe that the organization, to answer your question, Brian, we should go back to, you know, to discuss these things to some extent in school, to try to understand how people can take ownership of this kind of information, how to access it through, as Peter said, through a wealth of information that we can get through the internet, through websites and so on. But, you know, to learn how to use that, because otherwise we hit the barriers of ignorance, but also the barriers of information overload.
Yeah, good points. You know, one last thing before we open it up for questions here. You know, Gustavo, you've done a lot of really interesting work on crowdsourcing solutions and benchmarks of algorithms. Andy, you are curating biomarkers for digital health outcomes. Peter, you're providing a lot of infrastructure and technical interoperability for large-scale distributed research. And Katie, you're providing a lot of guidance as far as how individual participants interact with a large research program. So you're all, in your own ways, laying the groundwork for some sort of better tomorrow. I'm curious if you see that there, if and what you see are large gaps that are missing that may prevent us from getting towards whatever we think this idealized scientific future is.
Okay, I'll go. But I'll use it to say a few things, because there's some bridges. So one huge gap when we come to associating health data with, let's say, genomic or omic data, or research data writ large, is you can't move. The data becomes too big, and it becomes jurisdictionally centered. So I think we've got to move from, we've got to look at, when it's health data, not so much a gap, but creating the potential to share by leaving the data where it is and sending the algorithm, sending the query to the data. So we've got to federate the data, which is the opposite of the knowledge exchange. So when it's knowledge, make it central and make it global. When it's health data, federate it, leave it where it is, and control the rules by which people can use that data. So Baron Mons, who is one of the architects of the FAIR principles, has coined the phrase now, we've got to move from data sharing to data visiting. And I think that concept of the data stays within that trusted repository, within that institution. I go and visit it, and just as I would if I was visiting somebody's home, I have to behave in a certain way. And if I don't behave in a certain way, I won't be invited back. So I think that's a huge potential gap, is that where the data cannot move and shouldn't move anymore, but we can re-engineer that and send the query to the data and audit, monitor, track how people behave. The only other thing I'd say is this trust issue. I don't think there's a gap right now. There is a great survey by Anna Middleton, Your DNA, Your Say, and it's showing, I think it's confirming that even in a worst case, 50% of people would share their DNA data. It goes up to 95, 96% when you look at rare disease patients or cancer patients, when you're talking about sharing it with their doctor or a scientist. It's lowest when it's insurance companies or governments. but it's 50 to 95% of people willing to share their data. What could become the gap is if we fail and we breach trust. And if there are many trust breaches, those numbers will come down and the rules will come in. So I think it's incumbent on us all to preserve that trust.
Yeah, I think that's a good point in the gap of, like I said, we're really looking at different partnerships across the country with organizations that haven't been involved in research before. And so we need communities like this to embrace the challenge of working with organizations that can scale research. We need to be able to work with companies like Walgreens, like Quest Labs, like Fitbit, and really kind of figure out some middle ground of how we can make sure those organizations can enter into research and enter into the participant relationship with the trust that's necessary to stay there, and the security and the privacy principles. And I think the more conversations we have around that and kind of bridging those gaps and bringing in those organizations, then we can really scale the way we want to.
Great. All right, let's open it up for questions. We've got about just over 10 minutes left, so right in the middle back there.
Hello, microphone. I will just speak loud. Oh, it's on now. Hi, my name's Kate Wing. I work primarily in the conservation and natural resource management space, and so it's been great to learn all these parallels from the healthcare for what we need to do for all of these other data sources that I work with. And so I have a specific question about the quantification of trust and the lack there, and what happens when you lose trust. There has been some social science research on the cost of low trust systems. It slows down agreements. There's economic costs. And I'm curious if in this future scientific world we're living in, we might actually be able to either monetize or record ups and downs in trust breaches, not data breaches, but trust breaches, and use that as another way to reward and even sort of pay people who are trust creators, trust brokers. Not just sharers of information or good visitors at your data house, but people who actually add to the asset of trust that in the end makes a lot of these decisions and learnings easier.
I think that's so I'll just quickly jump in and say I think that's a really difficult thing to quantify, but I think we all operate in that space without actually having a number that goes along with it, right? As individuals in our career or organizations that we work in, we're continually being assessed on how trustworthy we are, and I think it's really interesting to think about if you could put a number to it or some sort of trustworthy scale, in particular, to Peter's analogy, where you start visiting different places. How does that play into your trustworthiness?
I think that I don't know how to quantify trust, but I remember the times in which one would hesitate big time to put your credit card in the web. When you were going to Amazon to buy books, because that was the only thing that they sold, right? And now today you do it almost without thinking, because the return of what you get out of it is kind of overcomes the fear that you have that your credit card number will be stolen. I think that to some extent, I think we will be much more trusting that the system is going to be working, and we will give our genomic information and electronic health records and so on, when we can really feel that the return of giving that is worth it and overcomes the fears. I have a close friend whose daughter has a genetic disease, and she will have benefited from sequencing her genome, the daughter's genome, but she was absolutely fearful of what problems the daughter will have in the future if that information were to be released, and she won't have good health insurance or won't have job offers because of that. So clearly she solved that equation in a way that is, I don't trust, right?
I think the number approach is hard because when you're looking at the numbers of whether or not somebody shares or if they're using their credit cards or whatever, is it because they trust or is it because they're ignorant what's happening? And I still think about the New York Times piece. I don't know if you all saw it when people were talking about like how many apps on your phone share your data and like how many apps know where you are, and people like lost their minds. You're like, what do you think all these apps are doing? Like, who downloaded Face app? Don't do that. Like, they just downloaded all your photos. And so I guess if you want to have like a bit of a mind game around trust and whether or not we can quantify it, there's a pretty amazing Black Mirror episode on reputation that is terrifying. But if you think about like as a driver in Uber, like, you know, somebody gets a rating, you have a rating if you're on Uber, and like how these like numeric ratings impact when we get access and not to certain systems. And Black Mirror like really plays this out in a way that like get dinner with friends afterwards.
Yeah, that was a great episode. Yeah.
So I just want to add,
Yeah,
I think there's...
we can get microphones over here. There are 2 questions, but go ahead, Peter, we got time.
So I mean, we've also, particularly since we're at SAGE, I mean, the idea of being open and being transparent and having informed consent or dynamic consent or patient consent. So those consent systems that we design and the contract, the social contract we make as a society, or the individual contract a system makes with a patient or a healthcare participant, it's about being honest to that contract. And if you can't guarantee privacy, don't say you can. And if you are going to share it broadly, say you're going to share it broadly, and make sure the person understands. And the more you can create that sense of informed, dynamic, patient-centric consent for some applications, but perhaps in others, broad consent is okay. So rather than saying it's, I get the big debates, what I'm trying to push people to say is look at the case, look at what you're trying to achieve, and then design your consent. But however you design it, be open, be transparent, and tell the truth. So if you had a breach, say you've had a breach. And I think that's how we build trust, not saying there will never be a problem.
And one last thing is when you design your consent, have your engineers in the room. There's an amazing piece that just came out by John Torres where he looked at end user license agreements and then he looked at what the apps were actually doing, like their packets. And like well-meaning lawyers write good consent forms, and then the engineers had no idea what was actually in the end user license agreement, so the infrastructure looked totally different. So.
Nobody reads it anyway.
Great, we got time for 2 more questions. One here.
Hi, my name is Eva Barbarossa, and I also work on the participant research for the NIH All of Us program. And I'm also a linguist, so the words we use are much of what I study and what they mean. And I think that this is really interesting. And Peter, you just kind of said what I was going to say, which is what we understand as trust is not the same thing as privacy or security or any of these words. And what we're finding in the research we're doing on trust is that people trust you if you tell them the truth. So if there's a breach, they want to know there's a breach. And so it's not about the belief that this will never happen, that there won't be a breach, but how we handle it. And so much of the research that we've been doing on participants, you know, they're just like, of course you're going to lose my data, everybody will have it, but what's going to happen to the person who does that? And that's the point at which we're finding with our research that that's the crux of how we build the trust. So.
Great.
Hi, can you hear me?
Yes.
Awesome. So Jane Roscombs, UBC and UW. I used to be at the Allen Institute too. I've been involved in a variety of increasingly larger brain data sharing projects over the last decade or so. And I loved Andy's example about the pacemaker piece, because if pacemakers can be hacked like that, who in this room watched Elon Musk's Neuralinks video last week? Yeah. So I was at an AI conference recently listening to science fiction writers talking about, well, duh, we've seen this kind of thing coming for decades. If you can hack a pacemaker and you have multi-electrode probes that are going into people's brains potentially completely changing the way they behave, we're going to have some serious trust issues moving further down the road that go far beyond what we're using our phone for. How can we skate where the puck is going and be a part of the system to build the trust that will be needed when things like this end up on the NBC nightly news? How can we be part of the ecosystem that will help build a greater trust in our community? What can we, I want you guys on the stage to tell us what we can do, and maybe other people from Sage, because we need to start doing it right now, I believe.
I mean, that's not the I mean, you don't need to like drill into somebody's brain to control how they feel about things. I mean, if you think about what social media does, right? Like social media shows you different things in your news feed. When you get shown things that are outrageous or make you angry, you spend more time on the site. There's a reason why we have more polarization, and this jacks up user engagement time. So you don't even need to drill, like just images is a very good behavioral moderation. So I think what we need to do is we need to hold the systems and the orgs accountable. Like the fact that we have big systems, and I think we hide behind free speech and a lot of other things where we should probably say like what kind of values do we want to have in our community, and it would be very hard to operate in this society if you don't have a Facebook account or you don't have a LinkedIn account, because a lot of those are gateways to other products. And so if you have big systems that like can modulate people's behavior, their brain space, I think we should, I don't think we should only, I'm definitely a capitalist, but I think there's also limits to like just following, you know, they made a profit, so it's fine.
Yeah, I think just to riff off that briefly, I think, you know, holding the bad actors accountable, you know, a lot of work that has gone into why commons are successful has to do with how do you punish the people who do not adhere to the communal standards. And so, you know, I think that's certainly probably likely here.
And I think Andy's right. I mean, so much of what we do, and we have to keep that in mind, that we are changing behavior in every single thing we do. The choice architecture we put into our systems, the way we present information, all of that changes the response to that. So if we're not taking careful consideration into those things, we're setting ourselves up to fail, and we're not doing right by our participants and our patients. And so the science on that side of things needs to be paid attention to.
Yeah.
Peter is going to jump out of his seat.
I think there's quickly here, and then one last one there, and we'll go to lunch.
Do I need a microphone, or I can also shout? No problem.
Streaming. The microphone is helpful for streaming.
Okay. I'm Peter Kapitein. I'm Peter Kapitein. I'm from Inspire to Live, Amsterdam-based organization, but I'm also partly working in the world of finance. And if I ask you the question, do we trust banks? Everybody says no. But we all put our money on a bank account. And the reason why we do that is because the regulation in finance is focused on the ones that we are working for. So if a bank goes bankrupt, everybody gets his money back. Well, in Europe that's the case, until an amount of 100,000 euros. The regulation, patient data regulation, is focused on science and clinicians and industry, etc., etc. But it's not focused on patients. That's the reason why there is so much debate by politicians, by lawyers, by bureaucrats, etc., instead of sitting at a table, talk about regulation on data, and then define the way you should organize it. And Peter, I like your idea about FAIR, because I think that is exactly the way you should solve the problem of privacy and security, et cetera, et cetera.
All right, thanks, Peter. Just real quickly, Eric, and then we'll get off to lunch here.
Thank you guys for a great panel. So to me, one of the things that I was hearing as a thread was just, it seems like the socio-cultural rules of what it means to be a good scientist are changing. Whether it comes down to trust, understanding the importance of tacit knowledge from the morning and otherwise. And so thinking also that, you know, like with all of us, there's a focus on the individual. What does that, my question is basically, what does that mean in terms of what does it look like to be a good scientist now in this culture, and what might be the idealized activities of a future scientist? Does a scientist need to be able to speak with sufficient humility? What does it mean in terms of how we actually understand the biases that we're bringing into our work? How do we make sure we have enough empathy and understanding of those people who we might not be able to actually speak to, and the input and the impact of the work we do? What is the impact in terms of when we define knowledge, like what is knowledge? In some sense, we're also categorizing that which is not worthy of knowledge. You can go to whosknowledge.org as an example of that. And all of those things are coming down to like the rules of the road on what it means to be a good person, a good scientist. So I'd love to hear people's thoughts on what does it mean to be a good person scientist?
So you mean ethically speaking, right? I mean, from an
ethical, legal, social. I mean, what does it mean? How do you know that you are a good human being who is doing more good than not?
Right.
Yeah, I know it's kind of a big question, but I think it's
and you know what? I think that's a great one for us to discuss over lunch. So